Hello, my name is Crystal Weaver. I'm a board-certified music therapist in St. Louis, Missouri, and I served as the principal investigator for this research study entitled A Retrospective Examination of Issues Addressed During Music Therapy Sessions with Adults Diagnosed with Cancer, a comparison of adults diagnosed with solid organ tumors versus adults diagnosed with liquid tumors. Adults diagnosed with cancer, whether solid organ tumors or liquid tumors, may experience psychological and physical issues throughout the active treatment process, which can adversely affect outcomes. Since the inception of the discipline, music therapy has expanded in the medical model to address the needs of adults diagnosed with cancer, both solid organ tumors, such as breast cancer, kidney cancer, prostate cancer, and stomach cancer, and liquid tumors, such as leukemia, lymphoma, and myeloma. Unfortunately, little is known regarding the predominant issues that are addressed during music therapy sessions, which are facilitated by board-certified music therapists with these individuals. The objective of this research study, therefore, was to determine the prominent issues that are addressed during music therapy sessions with adults who are diagnosed with cancer, sectioned by solid organ tumor and liquid tumor. These individuals were all undergoing active treatment for the cancer diagnosis, were on inpatient hospital status, and were 18 years of age or older. Institutional Review Board approval was received to perform a retrospective quantitative examination of music therapy sessions that were conducted at a Midwest region hospital over a 6-year period of time. All participants for this research study were adults who were diagnosed with a solid organ malignant tumor or a liquid tumor. 51% of these individuals who were diagnosed with solid organ malignant tumors self-identified as female. 49% of the individuals with solid organ malignant tumors self-identified as male. For the individuals who were diagnosed with liquid tumors, 59% self-identified as male and 41% self-identified as female. 623 medical records were reviewed for this research study. 345 listed a diagnosis of a solid organ malignant tumor, while 278 listed a diagnosis of a liquid tumor. Issues that were addressed during music therapy sessions were categorized into the following groups. 1, sociocultural suffering. 2, sensory deprivation. 3, emotional suffering. And 4, physical pain. From our data analysis, we were able to determine that the most common issues addressed during music therapy sessions with adults diagnosed with solid organ malignant tumors while receiving active treatment were 1, sensory deprivation at 28%, 2, sociocultural suffering at 26%, 3, physical pain at 23%, and 4, emotional suffering at 23%. The most common issues addressed during music therapy sessions with adults diagnosed with liquid tumors while receiving active treatment were 1, sociocultural suffering at 40%, 2, sensory deprivation at 29%, 3, physical pain at 16%, and 4, emotional suffering at 15%. This research study does advance music therapy clinical practice by informing board-certified music therapists and students regarding common issues that may be addressed during music therapy sessions with adults diagnosed with cancer who are undergoing active treatment and on inpatient hospital status. Potentially predicting these common issues allow board-certified music therapists to effectively prepare session plans, which can assist these patients with processing and addressing the psychological and physical challenges that are related to the active cancer treatment process. This research team is planning a future study that will determine if these predominant issues change as adults with cancer diagnoses transition from inpatient hospital settings to outpatient care, hospice care, or enter a survivor phase. One of the main challenges of conducting this research study was simply the quantity of medical records that needed to be reviewed. With 623 medical records that were available to us to review, it was a lengthy process for the research team to go through each one of these medical records and to successfully identify the issues that were addressed during sessions. This was a wonderful study for this research team to conduct throughout 2020 and 2021 during the COVID-19 pandemic. Unfortunately, at St. Louis University, many research study endeavors, including all music therapy research studies that involved the interaction with patients on a one-on-one or group level, were required to be halted due to the university's COVID-19 pandemic protocols. Engaging in this retrospective study allowed our research team and the music therapy program as a whole to continue our research endeavors throughout the calendar years of 2020 and 2021. Therefore, we were not minimized by our protocols that were enacted due to the COVID-19 pandemic. And additionally, we were able to continue the momentum of research studies endeavors throughout the last 2 years. Moving forward in 2022, we are excited to announce that St. Louis University has allowed the music therapy program to once again conduct research studies in person with our patient population. As we continue this retrospective examination, we are also encouraged to continue our other research studies endeavors that had to be halted over the past 2 years. Please do not hesitate to contact me. My contact information is at the bottom of this abstract if you have any questions or would like to discuss this research study further. Thank you.